And welcome back. October is Breast Cancer Awareness Month, and it's to help address the diagnostic challenges in breast cancer. Todos Medical developed the first blood test of its kind to accurately detect the presence or absence of breast cancer in women with abnormal or difficult to interpret image findings. Now, joining us to share more, we've got the CEO of Todos Medical Ltd., Gerald Commissiong. And Gerald, good to have you back.
Thank you for having me.
It's a wonderful opportunity to talk during Breast Cancer Month, and I know that so many people are glad that this month is here in terms of awareness and to bring more height to, heft, I should say, to the issues of breast cancer. So for us, an opportunity to share with somebody that's making a difference. When we talk about Todos, you're taking it to another level yourself. So give us a little bit about this.
Sure. So this test, called the Videssa breast cancer test, was developed originally spin-off of Harvard University. Developed over the last 10 years, over $50 million went in, over 1,000 patients prospectively gathered, and we showed 98.4% negative predictive value. So if we tell you don't have breast cancer, you have virtual certainty that you don't. And with regards to women who have inconclusive mammogram findings, that's a big deal because most of the time they end up going for secondary diagnostic strategies, ultimately leading in a biopsy, which can be very uncomfortable and can also present health challenges alongside the anxiety of waiting to whether or not you actually have a result. So what we see with this test is a real opportunity to make a difference for women with breast cancer who year after year go in and have abnormal findings only to ultimately conclude that there's nothing wrong. This would be a game changer for them.
Yeah. And so, how does this work?
It's very simple. Simple blood draw.
Mm-hmm.
At the doctor's office, they send it to our lab. We look at specific serum protein markers and tumor-associated antibodies with breast cancer, and we send back a result that tells you whether or not we find that you are unlikely to have breast cancer. So if you're unlikely to have breast cancer, there's almost 99% certainty that's the case. If that's not the finding, then we do recommend you go for more invasive testing, and you do go, in fact, get that that additional imaging and that biopsy because the heightened risk that you do have breast cancer. And so, that way you can target those additional interventions at the people who are highest, most likely to get it, and you can save the agony for most of the people, a vast majority of the people who are unlikely to have breast cancer after that abnormal finding.
When you talk about the abnormal finding, you have the abnormal findings. Sometimes when you read results, they can be not so easy to be able to be distinguished. Talk to us about what goes on the life of an individual who really has to encounter this because you go for a test and you hope that it's like, obviously the hope is that you're testing negative, but then when you get to the place where you find something that could be abnormal, you get to the place where difficult to be able to be read. On the part of that patient, there becomes this new sense of heightened emotions.
Yeah, absolutely. And the thing to remember about this is happens to, in fact, almost 40% of women. So this is not a small issue. This is a big issue. All of us, at least on the male side, we have wives, daughters, mothers who have to go through this, and it presents a real challenge because you have this inconclusive finding. And there's always, well, we're not sure if it's breast cancer or not. And then you eventually have the 2 to 3 week wait while you get those additional tests and ultimately get a result. And you have the fear of the biopsy and also the pain and the potential infection associated with the biopsy. And it's, again, not a small number of women that this happens to. So it presents, emotional challenges, not just for the woman, but for the family. It presents timing challenges. Women have to take more time off of work to deal with this, potentially healthcare challenges. So, having something that can really give a definitive answer very early on and dramatically reduce the risk associated with that is very, very important.
Yeah. And for yourself, talk to me about the role that Todos is playing right now, because this is obviously very much, as you say, a game changer of sorts, right? To be able to have this infusion into the lives of people who are, being tested. Give us your perspective on just the actual ability to have this test and your thoughts behind it.
Sure. So we acquired the rights to this test about 2 years ago, and we've been diligently putting the pieces in place to bring it back into the market because it was taken off the market because of basically financing. So we put the money in to acquire it. We're putting the money in to complete the development and get that unique CPT code, which is what is really needed to get reimbursement for the test, because obviously on a cash pay basis, it becomes quite expensive. So the role we're playing is we're putting in that effort and that money to be able to bring this forward, and then we're going to be doing the work to educate the population on the utility of this test. So that's really kind of the last few miles of bringing it to market, and then the real challenge of commercializing. So our strategy is we're going to go after some unique markets where we can get kind of critical mass, show the benefit in that population, show the benefit to the insurance companies so that they can ultimately cover it. That's always the barrier with some new technology, and then roll it out in more jurisdictions and ultimately nationwide. On an international front, we'll be doing the same, but we'll probably be doing that through partnership. Partner once we complete the next set of studies, partnering with local companies that can promote this and distribute it in those international places.
Yeah, Gerald, before we wrap up, I do want to have the opportunity to let you share with our viewers, as this is Breast Cancer Awareness Month, what you'd like people to know as we bring awareness to breast cancer.
Well, one of the big things to know, of course, is that during the COVID pandemic, there was a significant reduction in breast cancer screenings. So go out and get that screening if you haven't had it in the last couple of years. That's something that's obviously very important. Earlier the diagnosis, the earlier you can treat, and the better the outcomes for all the patients. For us, in terms of what we're doing, we're a public company. Our stock ticker is TOMDF. We obviously want to get as many people supporting the company as possible so that when we bring this out to the marketplace, it has a good reception. So follow us, www.todosmedical.com, as we embark on the journey of bringing Videssa into the marketplace.
All right. Well, Gerald, we have to leave it there, but thank you for the work that you're doing. And thank you for bringing us some more information during Breast Cancer Awareness Month that we can be able to pass on to our viewers across New York City. Thanks for joining us.
Absolutely. Thank you for having me.
All right, and good to see you again. All right, I want to let you know now, if you want more information, of course, visit the website at todosmedical.com, and then follow them on Twitter, at Facebook, I should say Twitter and Facebook, at Todos Medical. We encourage you, please don't go anywhere. Open will continue right after this.